Hi, my name is Annabella Lee. I'm with the UCSD Guardian, and today behind me, we're at the AFSCME strike. Now, from Monday, November 17th to Tuesday, November 18th, from 7 a.m. to 4 p.m., we will have these strikes at different locations such as the Gilman Drive, Hillcrest Med Center, and the La Jolla Med Center. Now, the workers at UCSD have expressed their concerns about livable wages, affordable housing, and healthcare. Today, we're going to be interviewing the workers at our UC campus, and they'll share their experiences and how they have been affected personally.
Sure. My name is Isaac Zamora.
My name is Amelia Sandoval. I'm at the School of Medicine.
After the strike, what response would you like from the UCs?
I would like for them to treat us like humans, to actually think about the wage they give us, how it for a family of four, I can't imagine what my coworkers are going through. I'm a single person, and I can barely afford to be in California with the amount we get.
What are the main goals of the strike, and can you elaborate on them, and what do they mean to you specifically?
Sure. So I've been working here for about 17 years. I'm a respiratory therapist. I work in the ICUs, the emergency department, all over this hospital. Wherever there's patients, I go. So I've been here for a long time. Worked the entire pandemic. We've seen a lot. We've seen a lot of issues in our department with recruiting and retaining. We're constantly short-staffed. There's a recruitment problem. There's a retention problem. I think because of the pay being where it is, pays very low for the type of work that we do. We deal with a lot of end of life, people that are on mechanical ventilators, very challenging situations. Sickest patients in the region come to UC San Diego Health for their care, and we simply don't have enough people to do the work. So there's a lot of burnout, there's a lot of turnover. A lot of it is because of the conditions that we work under, which the wages are not where they should be. Certainly, there's other things like patient safety issues that we should have safe staffing. There's also the medical contributions to have insurance. I have my whole family here under UCSD Health. My girls were born here. My wife gets her care here, and my premiums currently have skyrocketed. Premiums are what you pay to have insurance, right? So they used to be stable, and then the university came in and implemented new conditions on us because we're out of contract, and that ruined all of it ruined everything for health from a healthcare perspective for a lot of us workers, where you're paying more out of pocket than you ever were before. Certain medications are no longer covered. Your copay to see your doctor went from $20 a visit to $30 a visit. When you have a family of five, that adds up real quick, and it actually kind of rations the amount of times you can go see the doctor, even when you're sick. So considering I work in a hospital, it's tough for me to kind of accept that. But yeah, that's some of the issues are around wages, around staffing, around healthcare.
Yeah. And do you have a personal experience with your family and the specific wages that you have been receiving?
With the specific wages, yes. Like I said, the increase in food, the increase in gas alone. I live all the way in Chula Vista. Imagine coming every day back and forth. The gas is going up. Price of eggs are skyrocketing. And we only get crumbs, and I feel that we're being treated poorly and unfair, while people on top are living the life.
How have these current circumstances have affected your day-to-day lives and work as well?
It's devastating. And in the work, because they're not hiring people, they're not replacing people who are retiring, it's difficult. The areas are being split. We're being given more work. We're expected to cover more than we're supposed to. And they want perfection without paying us the right amount. And not only that, we should be getting more people. They should be hiring more. They have more for hospitals. They have more for schools. What about us? Why are we being left behind? Because majority of my peers are Hispanics because they don't understand English? That's wrong. We should be treated as humans.
How have these current circumstances have affected your day-to-day lives?
So it's difficult. I mean, just from a even like rent perspective, housing, we're in a housing crisis right now in San Diego. If you read the news at all or talk to people at all, you realize how unaffordable it is to just live in San Diego County. So what I've seen is just, again, I've been here for 17 years, but I've seen this kind of mass exodus of my coworkers driving further distances because they can't afford to rent, certainly to own anywhere in San Diego. So the new mecca is going to be Riverside County. So Riverside County is now like a beacon for all low-wage workers to come up there and find more, it's not affordable, but more affordable housing, but you have to consider the commutes. The commutes from here are hellish. Like to drive from here to Temecula or to I have a coworker here that lives in Lake Elsinore, and to have to live in Lake Elsinore but you work in La Jolla, something is wrong. Now, for the people that are not in this union, for the executives and for the people that work here and make good wages, it's a non-issue to them because they can live in comfortable places nearby. That's not the case for us. So you have higher fuel costs, just the commute time. We had a coworker who worked multiple shifts back to back, and on his day off was driving home and crashed his car because he fell asleep. These are some of the things that we have to deal with because the unaffordability that's here in San Diego is playing out in our daily lives. My commute is at least going to be about an hour and 20 minutes till I get home. I live in Fallbrook. So we got to do that commute and the gas and all that. So workers are getting hit from all sides, and we're here to make sure that we get what we need.
Do you think the 3-year contract starting this year and gradually increasing rate is enough?
If they actually give us our demands of the 3-year and the 8% increase for the first year, it's a start. It's a good start. But what they're offering right now is not a good start. And a 5-year contract at a lower pay, no, it's not. Prices keep going up, and we're just at the bottom.
AFSCME 3299 is the largest union of UC workers. Although the strike took place over 2 days statewide, the UC system has yet to respond. To learn more about the strike, you can read our print issue distributed at various locations on the UCSD campus or read it online at ucsdguardian.org.